My name is Matthew Orozco. I work in the Cath Lab here at Community Memorial Hospital, and I'm a Radiology Tech Specialist / scrub. This is Cath Lab room 2. This is considered the everything room, I guess you would say. This is what I tell everybody that asks me. I'm like the doctor's right-hand man. So whatever the doctor needs, I provide to him. So he needs a specific wire, he needs this, that. That's what I do. Because we kind of do everything in here. We do hearts, we do neuro, we do angio cases, vascular cases and such. We pretty much do it all here. IR cases for the radiologist. Everything kind of gets done here. It's mind-blowing what goes on here when I tell people what we do, opening people's coronary arteries or getting blood flow down the leg, just stuff that nobody knows that goes on here, And hopefully that helps them in turn. If they ever, God forbid, have to go through something like that, I can be there to comfort them.
Matt's hardworking, he's fun.
He's Inspector Gadget in that fanny pack. Anything you need. Let's go. And luckily they wanted me up here. Diane and Erin were really pulling for me, and that was a big motivator, And
to add people to the department that will only enhance the feeling of family. And so when I interview people, and when Rayanne interviews people, that's really what we're trying to find out. We want to know if they've, how many years of experience they've got and what their background is and things like that. But what we're really trying to find out is how they're going to communicate with their team when something's not going right.
Pieces of equipment that are used for specific procedures that we do. Gloves are probably the biggest key. Mm-hmm. Sterile gloves, always got to be sterile. I think what I'm most proud of is being able, for me personally, to be part of the team and actually be a functioning player with that team, which in turn helps the patient. And that's what I'm most proud of. I want to see, on Monday when I check Facebook to see what's going on, I want to see my team, was out having fun and doing some stuff, and even if it was going to Denny's or something like that after they got called in at 3 o'clock in the morning. That makes me very happy to see that they have those kinds of bonding experiences, and that's why we want to make sure that someone coming into this department fits with that. I've been at this hospital for 15 years, and I was an X-ray. So I've known a lot of these people. I was I was his clinical instructor. A lot of these guys, clinical instructor, and now they were teaching me, which I thought was super impressive when I came to the Cath Lab about almost 2 years now. So, and it just says a lot about this institution. People stay. There's not a lot. It's just great. It's cool.
Yeah,
you're working with your friends.
Yeah. I mean, I always looked up to Matt when he was down there, and I was a student.
Yeah.
And till now, I still do.
Jeez, man, this guy.
My name is Alfredo Pantoja. I work at Community Memorial Hospital in the Cardiac Cath Lab. I am in charge of monitoring vitals on patients. Also, we do surgical scrubbing, and on occasions we'll do X-ray circulating.
Very handy. Me and him are on the same team, which made my life easier.
It's quite enjoyable.
No, it's very. Getting called at 3 in the morning with this gentleman right here, he really turned, it's no joke, he really turns it around.
With our nurse and our doctor we're just keeping an eye on the patient's blood pressure, on their heart rate, if there's any sort of changes with their vitals as we are doing our procedures. My job is to document that and also to report back to our staff.
Alfredo's our goofball friend here. I mean, he is always the, good with a joke, but so professional, so good. Usually with TAVRs, I work with him when he's in the monitor role, and it's fun because I literally sit next to him during the case, so we're, making sure everything's documented, but at the same time, trying, we have a good time.
The confidence that I built while I've been here, I'm very proud of that. Seeing people that came in after me, or my fellow staff that came in after me, and seeing them grow, and get the confidence, get the knowledge, get the all the skills that are going to carry them further. I think that's really something to be proud of.
When I think of how much they know, which honestly is so much more than I knew when I was working in their position, it amazes me, and I am so proud.
We love being around each other. At least I feel that we do, which in turn, it shows in our bedside manner, shows in our patient care.
I was a clinical instructor, and we all went out.
I feel like they look at this place as their home, and it sounds so goofy, but I know that they think of their coworkers as their family.
And it's gone by like that because I must be having some kind of fun with who I work with.
Always. Well, now that she's gone,
Okay, seriously,